It's very important, and everybody in the room is very aware of the existential crisis to humankind from climate change. And there's a really important role, I think, for healthcare professionals in that, because of we're commonly dealing with people who are a bit worried and a bit frightened, as we were saying on the ride round town there. And there's a way of dealing with this. Maybe it's indifference or ignorance, but for a lot of people it's a big problem. Let's not talk about it, and let's ignore it because it's too difficult, too frightening. We have a role as healthcare professionals in saying, actually, yes, it's very important, but you need to notice it, you need to do something about it, and look at the example that we're giving. So I think that's the first thing. We have a really important role as advocates for changed human behaviour to deal with the climate emergency. And as institutions like colleges or pharmaceutical society, whatever we might be, we're membership organisations. We have 15,000 fellows and members across the world. Speaking out about this is something they want us to do, that's very clear feedback, but it gives us a reach to healthcare professionals who, in their daily interactions with their patients and people they care for, gives us a reach for this message. So advocacy, I think, is really important. We then need to lead by example, as we've been doing by cycling around today, and our key messages are about what individuals can do in their own personal lives, but also what they can do when they're at work. We've all mentioned our kind of guilt around carbon production. Well, I'm a surgeon. Of our 4% of carbon production in the UK from the health service, operating theatres are responsible for about 2/3 of that. So we can do things differently. So there's things that we can all do as individuals in our clinical practice and in our day-to-day lives. So active transport, thinking about what we eat and the production of the food that we use to fuel our lives, really important things as individuals. As institutions, advocacy and changing how we do our day-to-day business, what are our institutional travel policies and so on. So there is no bigger issue for us to be talking about just now, and as healthcare professionals, as institutions in healthcare, we have a good voice for us to use, and people are used to listening to, and they trust us in a way that they maybe don't trust politicians to quite the same extent. So I think we've tried to frame it in three ways, Fiona. Firstly, to say what's the impact of climate change on human health, as we've just been hearing about air pollution, respiratory disease. Secondly, what's the impact of the delivery of healthcare on climate change, as I mentioned earlier. And the third really important component is what can individuals and institutions do about that. So I've made it my priority for this first year in office. We're a very uncompetitive college, so we didn't.
The most uncompetitive.
We are the most uncompetitive college, correct? So we didn't even bother to reply to that scorecard. But we have, before my time in office, however, we have invited the authors to come and present at our President's Conference in November to shame ourselves and to laud our sister colleges. And
Guilt is a great.
and we'll take it humbly. So we're having a conference to try and pull these themes together. Because again, just to come back to that power of the colleges to interact, as Martin has mentioned, with government and so on, to work with the NHS in England, NHS Scotland and the other devolved administrations to say, actually, we should all be doing this together. This is about joined up activity, as we've seen with 30 or 40 of us riding around London today. So that's what we're doing, and it is our number one priority for this year. And we have this opportunity to reflect that COP26 was a year ago in Glasgow, in our hometown. And so the theme of the conference is to say, well, 1 year on from COP26, where have we got to? And we're going to link to Sharm el-Sheikh and through the Egyptian government to try and move health up the agenda of these international discussions about climate change. No, I think it is a public health issue, and so I don't think we have any difficulty as healthcare professionals speaking about the climate crisis, because it's clearly a public health issue. I think as we deepen that conversation, then we put ourselves in the place of saying that active transport is a good thing to do. Once you start being on a bicycle or walking through the town, then air pollution is more of an issue than if you're sitting safely inside a car or whatever. And we have that interaction and that voice to use in the same way that we did, I think Martin mentioned smoking. I mean, the medical profession was a huge part of people stopping smoking after Richard Dole's evidence that we stopped smoking. The profession did, and we lobbied. I think the thing here is we've got to accelerate this, because we're not going to change the climate crisis by everybody getting on a bicycle, however well marshalled, or changing the packaging that we use or recycling. What we've got to do is have a much bigger political discussion, but as healthcare professionals we can be speaking about the impact on human health, putting our own house in order, in what we do, and then widening that conversation so that everybody realises that there will be 1 billion refugees moving, that extreme weather events are existential in their impact. And then what we need to do is stop putting up buildings using lots of cement and steel. We need to stop taking fossil fuels out of the ground. Now, fossil fuels aren't part of healthcare in that sense, but if we get the conversation going as we are at pace as healthcare professionals, then all these other things will surface.
Thank you very much.